What if I told you the first signs of lung cancer might already be staring at you in the mirror and most people completely miss them? You don't need a CT scan to spot early warning signs. Sometimes you just need to look closely at your own face. While many people wait for a persistent cough or chest pain, subtle facial changes can appear much earlier. And by the time breathing problems show up, the cancer has often already spread. I am Dr. Suman Paul, a consultant respiratory physician in the UK. I work in the NHS and in the private practice in Manchester and Liverpool. I see these signs in clinic every single week. Let me be very clear. Having one of these does not mean you have lung cancer, but it may mean your body is trying to tell you something important, and ignoring that signal can cost valuable time. Before we dive in, I am a doctor, but I am not your doctor. This video is for educational purposes only and not medical advice. If you have severe symptoms like chest pain, breathlessness, at rest, coughing up blood, call 999 immediately. Now let's go through these 7 signs. I want you to pay close attention because some of this might be happening to you right now. First, waking up with a swollen, puffy face, especially around the eyes, neck, and the upper chest. Your face feels tight, your shirt collar suddenly feels too small. This isn't just poor sleep. There is a major vein called superior vena cava that drains blood from your head and the upper body back to your heart. If a tumor in the upper chest presses on it, it acts like a dam in the river. Blood backs up, the face and the neck swell. The key clue for this is it's worse when you lie down and slightly better when you are upright. You might also notice prominent veins on your chest, facial redness, and morning headaches. If your collar size has increased without weight gain, that's a red flag. Second, one droopy eyelid, along with a smaller pupil on the same side. This is called Horner's syndrome. It can happen when a tumor at the very top of the lung, known as Pancoast tumor, presses on the nerves that control the eye and the part of the face. Stand in front of a mirror. Cover one eye, then the other. Is one eyelid lower than the other one? Is one pupil smaller than the other one? Does one side of your face sweat less? That combination matters, and it can appear months before any breathing symptom. Third, blue or purplish lips, even when you are warm. This is called cyanosis. It means your blood isn't carrying enough oxygen. In advanced lung cancer, oxygen transfer in the lungs become impaired. The lips, because the skin is thin and blood vessels are close to the surface, can show this early. Many people assume they are just pale or have poor circulation. But persistent blue lips, especially with breathlessness or fatigue, requires urgent medical attention. The fourth one, sudden unexplained facial flushing. Your face becomes red and hot without a trigger. Not spicy food, not alcohol, not menopause. Certain lung tumors, particularly bronchial carcinoid tumor, can release hormones like serotonin into your bloodstream. That causes blood vessels to dilate suddenly. These episodes come out of nowhere. They may be accompanied by diarrhea. They can last minutes to hours. If this happens alongside respiratory symptoms, even something as simple as a persistent cough, it needs proper investigation. Carcinoid tumors are actually amongst the more treatable lung cancers when caught early. Fifth, a rapidly rounding and reddening face, what we call moon face, along with easy bruising. This can happen when certain lung cancers, especially small cell lung cancer, produce a hormone called ACTH. That hormone drives your body to make excess cortisol, leading to Cushing syndrome. You might notice your face becoming fuller over weeks to months. Your cheeks look red. You bruise easily from minor knocks. You gain weight around your abdomen. Your skin becomes thinner. Many people assume it's just aging or weight gain. But if it's happening quickly and you feel weak or fatigued, it's a hormonal issue that needs investigation. Sixth one, a very specific purple rash on the eyelids. Sometimes it also appears on the knuckles or across the shoulders and upper back. This is a condition called dermatomyositis, which is a paraneoplastic syndrome. This is associated often with cancer. It means your immune system is reacting not only to cancer cells but also to your own muscle tissues. The eyelid rash has a violet tone, what we call heliotrope rash. On the knuckles, you may see raised bumps known as Cotron's papules. You might also feel muscle weakness, difficulty climbing stairs or lifting heavy objects. It's rare, but when I see it, I immediately think we must look for an underlying cancer. The encouraging part is that treating the cancer often improves the rash. Seventh, unusually long or thick eyelashes. This is called trichomegaly, a very rare sign. It sounds almost trivial, but it can occur in lung cancer patients. We believe it's related to growth factors released by the tumor that also stimulate hair follicles. It's very rare and more commonly seen in after chemotherapy. But if it appears alongside other signs such as facial swelling, a droopy eyelid, or persistent cough, it becomes part of a bigger picture. Now take a breath. One of these signs alone does not mean you have lung cancer. Many have other explanations. But you need to act promptly if you are over 55, have a history of smoking, even if you have quit years ago, and have a cough lasting more than 3 weeks, unexplained weight loss, worsening breathlessness, or persistent chest pain. If one of these facial signs appears alongside those risk factors, you cannot afford to wait. Early detection changes everything. When lung cancer is found at stage 1, the 5-year survival rate is over 60%. At stage 4, it falls to less than 10%. These facial signs can appear months before your breathing symptoms appear. That window matters. In my practice, I often see patients who were told it was stress or aging. But when we do proper investigations, for example, a chest x-ray, CT scan, some blood tests, we sometimes uncover the real cause. And the earlier we find it, the more treatment options you have. If you are in the northwest England or surrounding areas and you are concerned, don't guess, don't wait. Book a comprehensive respiratory assessment with me. You will find the booking details in the description box below. You don't have to sit at home wondering whether what you are seeing in the mirror is serious. If this has been helpful, please share it with someone who might need this. Also, please hit the subscribe and the like button. This will tell the YouTube algorithm that this video is really important and it will start showing it to more and more people like you. And if you'd like more clear, evidence-based guidance on respiratory health, watch my previous videos. The more you understand your body's signals, the better you can protect your lungs. I am Dr. Suman Paul. Thank you for watching. See you in the next video.